Scanning room. Okay. Once I have scanned the room and gathered my supplies, I'm going to perform hand hygiene. I'm going to knock on the door. Hey, my name is Shanta Davis. I'm a nursing student with CVCC, and today I'll be doing a head-to-toe assessment on you that does require for me to touch you. Is that okay?
Yes.
Can I have your name and date of birth?
Anthony Davis, 3791.
Any allergies?
No.
Are you in any pain right now?
No.
Okay, and I am just going to verify his bracelet. It does say everything that he just said. And then once I do that, I do have a couple of questions. I am going to provide some privacy as well if I haven't done so already. Do you know what year it is?
Yes.
What year is it?
2025.
Where are you at right now?
And
Who is the president?
Donald Trump.
Okay, so patient is alert. A&O times 3. Facial expressions does not show any signs of distress. Clothing is appropriate for the weather. I do not smell any body odors. Patient is sitting upright in the chair. Body coordinate is coordinated. Mood is appropriate. Also, cognitive abilities is intact. Okay. Once I do that, I do have to put on my gloves. I am inspecting your head, and I see that it is midline symmetrical. I do have to check your hair. And I do want to verbalize before I do this your vital signs. So for your temperature, I got 98.1. Blood pressure was 124/72. Pulse was 74. Oxygen was 96 on room air, and then your respirations was 18, okay? All right, and I am feeling his head. Don't feel any bumps, or I don't see any lesions. Do not see any dander or lice, okay? And I'm gonna take these gloves off and perform hand hygiene. I am gonna get you to smile for me, frown for me, blow out your cheeks for me. Show me your teeth. Close your eyes tightly. Okay. Cranial nerve 7 is intact. Let me know when you feel this, okay?
Yes. Yes. Yes.
Okay. Cranial nerve 5 is also intact. Okay. Once I do that, I am going to move down to your ears. They are symmetrical to your face, evenly distributed. Head is appropriate too, also for body size. I do not see any drainage coming from your ear, okay? I am going to feel your ears, okay? I'm just feeling your, the auricle, the tragus, and the lobial, and I'm also inspecting, gonna feel your mastoid and the auricle, okay? Is that tender?
No.
Okay, non-tender. Okay, I'm also gonna get you, I do have to do a test on you, cover up that ear for me. And I'm gonna say a word, you just tell me what I said, okay?
Apple.
Okay, other ear? Orange.
Orange.
Okay, I'm gonna redo it because I didn't whisper it. Put it over your ear.
Pear.
Okay. Cranial nerve 8 is intact. Okay, gonna move to your eyes. Eyes are even and round and symmetrical to his face. Just looking at it, I don't see any redness or irritation to his conjunctive area. I am gonna dim the lights and flash this light in your eye, okay? Don't look directly at it, okay? Okay, eyes are accommodation to light and reactive to light and accommodation. Pupil size is 3. Okay. Moving, and I'm gonna go ahead and do this test too, okay? So you just follow this with your eyes and not with your head, okay? Okay, all gazes is within normal limits. Cranial nerves 3, 4, and 6 is intact. Moving down to his nose. Nose is symmetrical to his face. I am gonna palpate. Okay, I do not feel any lumps or masses on his nose. I'm gonna just take my pen light and look inside real quick. Okay. Drainage is clear, no irritation or anything like that. I'm gonna get you to use your hand and plug up on your nose. Breathe out. Okay, do your other side. Breathe out. Okay. Airflow is patent on both nostrils bilaterally. I'm going to check your temporal pulses. Okay. Temporal pulses is 2 plus bilaterally. Moving down to your mouth, I am looking at his mouth. Mouth is pink. I don't see any lesions or anything like that. Can you show me your teeth? Okay. Can you open for me? Okay. Just looking inside, uvula is midline symmetrical, no lesions or irritation. Oral mucosa is moist and pink. I don't see any lesions or irritation. Hard and soft palates are within normal limits. Teeth has no decay, and I don't see any irritation on gums or any lesions. Okay. And once I do that, I am going to test your tongue string. Can you stick your tongue out for me? Can you lift it up for me? Okay. I'm going to check your gag reflex. Say gag reflex is within normal limits. I am going to put my hand on your cheek, press against it with your tongue. Okay. So cranial nerves 9 and 10 is intact. Okay. And once I go down, I am going to check your carotid worm right here, your carotid pulse one by one. Okay. Carotid pulses bilaterally is 2 plus. Once I do that, I am going to also check his lymph nodes. Okay, so the preauricle, postauricle, occipital, submandibular, and then his clavicle. Is it tender? No. Okay, all non-tender and within normal limits. Once I do that, I am going to palpate his thyroid. And I don't see any bulging or anything like that. It's not enlarged. I am going to get you to sit at a 30 to 45 degree angle. So, and I'm doing this to check for jugular vein distension. I'm checking it. I do not see that vein distended at all, so that is within normal limits. I am also going to check his pulses in his upper extremities, which would be his brachial pulses right here, going down to his radial. Okay. Brachial and radial pulses are 2 plus bilaterally. Okay, and once I do that, do you mind removing your shirt for me? Okay, and I'll just put it right here, okay? And then once I do that, I am just checking out his anterior chest area. I do see that he is breathing evenly and unlabored. I am just going to palpate and tell me if it's tender. Tender? No. Okay, within normal limits. Once I do that, I am going to listen to your breath sounds, okay? Okay. Alrighty. Breathe in. Breathe in. Breathe in. Okay, I'm gonna put it right here. Breathe in. Breathe in. Breathe in. Okay, breathing sounds within normal limits. I'm gonna have you scoot up a little bit. I'm gonna check your back area. I'm assessing. I don't see any. I see that he's breathing evenly in the back area. I am going to just touch. Tell me if it's tender. Non-tender? Okay. And then I'm touching and I'm also going to listen. Okay, breathe in for me. Breathe in for me. Breathe in. Breathe in for me. Okay, breathe in for me. Okay, breathe in for me. Okay, posterior breathing is and back area is within normal limits. I'm also going to, you can sit back for me, sorry. I'm also going to assess the abdomen area just by looking. I don't see any retractions or anything like that. I am going to listen to your bowels. I'm going to start in the left lower quadrant. and work my way clockwise. Okay, and then I'm just going to percuss. Okay, so vowel sounds is within normal limits. Percussion sounds is hollow and I can hear them. I am going to palpate your abdomen. Abdomen is rigid and non-distended. And then once I do that, I am going to check. I do not see any edema. Skin is warm, dry, and intact. I am checking the capillary refill. Capillary refill is less than 2 seconds. His turgor is also less than 2 seconds, which is good. I'm checking the lower extremity pulses, femoral pulse, his popliteal pulse, his posterior tibular, and his dorsal pediis, all bilaterally 2+. Okay, sir. Once I do that, I have already assessed the genital area. No irritation, and I can see nipples. He does not have any discharge or irritation or lumps or masses. If it was a woman, I would, educate her on how to do the breast exam. And two, if it was also a woman, I would ask about her menstrual cycle and report any changes if she has any kind of discharge or anything like that. But scrotum is within normal limits. Check the rectum area. He does not have any hemorrhoids. When was your last bowel movement?
Yesterday.
Okay. Last bowel movement was yesterday. Was it normal?
Yes.
Okay, it was normal. I am gonna have to check your. I do have to do a test for me. Can you stand up for me? Can you bend down? And I'm just checking your spine. Okay. Just feeling. Does it hurt?
No.
Okay, non-tender and spine is in with normal limits, no signs of scoliosis or anything like that. I do want to check your gait, so I do want you to walk straight back and then straight back to the wall for me. Okay. Gait is steady. Can you get on your toe? Do like this on your toes for me and walk back? The best way
Walk
you can.
back?
Walk forward. I'm sorry. And then come back to the chair. Okay, gait is steady. Okay. And two, I also forgot to check your strength with your shoulders. Just when I try to be push up. Okay, try to resist yourself. Okay. Okay. Cranial nerve 11 is also intact. Give me your hands. Squeeze as hard as you can. Not too hard, but as hard as you can. Okay. And then push me. And then try to resist. Okay. Strength is adequate for the upper extremities. I'm also going to check capillary refills in his feet and also the strength. Okay. Okay. Checking feet. Capillary refill is 2 seconds. Less than 2 seconds. I'm sorry, yeah, less than 2 seconds. Okay, can you extend your feet for me? Okay, lift them, extend them, okay. Okay, push them down. Alrighty, strength in bilaterally lower extremities is adequate. And I think that includes our head to toe. Thank you.